Hello, Professor and classmates. This is Rocio Lashni, and for this week, the case that we are going to talk about is geriatric pulmonary. So last week, I had a lady, Miss SB. She is 71 years old, Caucasian geriatric female that presented to the office accompanied by her daughter, and she stated, or her chief complaint was, I came because I cannot breathe normal. Her HPI, 71-year-old, geriatric Russian female with a past medical history of controlled hypertension, cigarette smoking for 25 years, COPD, presented to the office for concerns of increased shortness of breath and some productive cough with thickened sputum that initiated a couple days ago. She states that those symptoms becomes worse when doing her morning walks, and those symptoms will mildly subside when resting. So she denies taking any medicine to relieve symptoms, remembers using an inhaler when like years ago, but she doesn't remember the name of the inhaler that she used to use. So again, past medical history, COPD, who was diagnosed at age of 65. Last hospitalization was years ago. She does not remember when. Her hypertension diagnosed at 55 years old. And her cigarette smoking, she used to smoke a half pack for 25 years, from 30 years old to 55 years old. And she quit in 2008. I think it is important to mention her social history because she is a retired assistant, widow, has only one daughter, and she works from home. And the patient states that she just moved in with her daughter 2 weeks ago in a house from 3 beds and 3 baths. But she mentioned that her daughter smokes. She didn't exactly say if she was smoking in front of her, but this is a pretty second-hand smoking exposure for this lady. So the auscultation, or the assessment, the physical assessment that it was performed, she had an increased breath sounds with mild posterior wheezing, slight use of accessory muscles on inspiration, but negative for any crackles, chords, or any other pulmonary sounds. I've seen her, or we've seen her, having a moderate productive cough with thick, clear, and non-malodorous sputum. So no cyanosis and no nail claving or nasal flaring observed. So the differential diagnosis for this lady is congestive heart failure, asthma, bronchiectasis, but the primary diagnosis was COPD exacerbations, since she already has a history of that. So the treatment for this lady, it was added the short-acting bronchodilator, albuterol, 90 micrograms inhaler, 1 to 2 puffs every 4 to 6 hours as needed. So this was my case for my lady. And I don't remember if we need to mention other, like a follow-up, but I think it is important to mention that one of the recommendations was to come back to the office in 5 days to see how she reacted to the treatment. Thank you so much.